In our summit rounds this morning, we talked about trigeminal neuralgia, but specifically we talked about how pain and severe illness and a variety of other causes can lead to depression and even suicidal ideation and suicidal thoughts. So I want to talk briefly about what you or a loved one should think about doing if those thoughts are coming. First of all, it is normal to experience some depressive symptoms in life. Surgeries, pain, disability, loss and grief can all lead to depression and depressive thoughts. Sometimes patients can start to think about ending their life and can even start to think about a plan to do so. If that's the case, we in our discussion talked about that you should or your loved one should consider getting help. Don't hesitate to go to the emergency room. Don't hesitate to call a hotline. It is a real and immediate a medical emergency when somebody is having suicidal thoughts and starting to develop a plan around it. In our summit rounds this morning, we presented an otherwise healthy young man with everything in the world to be happy for, who was suffering from a severe painful condition, in this case trigeminal neuralgia. And he started feeling very depressed, and even though he never would have thought about it otherwise, started thinking about suicide. And that is something that sometimes people that are otherwise completely normal can have extenuating circumstances affect them. So it's just something to be aware of, because and we've seen patients that have been victims of suicide who may have been able to have it be prevented. So I think the message from the rounds this morning is there are resources, and don't hesitate to let somebody know that you're having a problem so that those around you can help.